Hi, this is Dr. Brainwaves. I'm Dr. Rena Azar. This is Dr. Susan Raschal, who's going to give us an overview of asthma management. We've talked about triggers, we've talked about the cause of asthma, and she's going to go over what treatment options are available. It's also important, and she'll include this as well, to not just treat acute asthmatic or sudden severe asthmatic episodes, but also to look into ways that you can prevent asthma.
So I will not be going over acute asthma treatment, but I'm just going to be going over just a management of chronic asthma. So as you know, asthma is a disease of the airways, which are the tubes in the lungs. And those, unfortunately, can cause cough, wheeze, shortness of breath, chest tightness. And again, we talked about some of the diagnostic ways that we have to identify if someone has asthma. And now we'll talk about just briefly some of the management strategies that we use. One of those is avoidant measures. So the first thing you want to identify, or your provider will identify, is what is the trigger for asthma. And so if it's allergens, then we talk about some avoidant measures specifically for allergens, as well as allergen immunotherapy, which is the shots, drops, or tablets. And what's interesting about them is that that is the only modality that's been shown to help prevent the development of asthma. And that is, again, allergy shots or allergy tablets. So most likely the allergy drops will also do the same thing, just because the mechanism by which it works is very similar. But that is identifying what the trigger is, and if it's allergen, then we can go utilize that modality. So another thing that we need to identify then is establishing what medicines is going to be ideal for the person. So if these days, anybody who has persistent asthma, and persistent asthma includes mild, moderate, or severe, and that's one of the ways we classify asthma based on symptoms and based on spirometry, which is that breathing test that we also look at, is going to be to look at what they need. And everybody who has persistent asthma needs to be carrying an inhaler that has albuterol or something similar to albuterol in it. And there are some trade names such as ProAir, Proventil, Xopenex. Those are common medicines that will have the ability to be able to relax that tissue on the outside of the airways, opening up that pathway or that airway or that tube so that you can breathe a little bit better. That medicine, again, is designed as a prevention for exercise-induced symptoms. So if someone is an athlete and every time that they go outside, particularly if it's cold, dry air, it causes their smooth muscle to get tight, that would be a perfect opportunity to utilize that rescue medicine. Again, we refer to the albuterol medicine as rescue because it works very quickly, and it's designed to give the person a little bit of time before they need to do other things to get their asthma under control. Again, a maintenance medicine is going to be inhaled steroids. And there are multiple inhaled steroids that are available on the market and can be utilized very easily, as well as another medication called montelukast or Singulair. Unfortunately, over the last 18 months, a black box warning has been placed on that medicine because it can cause mood changes. So now we have to inform people of the fact that this medicine does have a black box warning on it. So if someone has a propensity to depression, it may not be the very best medicine for them. So that also is going to be a medication that is designed to treat asthma, mild asthma in particular. So again, when we talk about the asthma, I mentioned the classifications, there are very specific recommendations based on the classification of asthma. So someone who has mild asthma, ideally they need one inhaler or Singulair, montelukast, or a medicine like that, in addition to their rescue inhaler. The rescue inhaler, again, is something like albuterol. Then if they go to a moderate asthma, they can either increase that single medicine, that single inhaled steroid, or add on therapy. And when they add on to that, it can be a medicine that, again, relaxes the muscles on the outside of the airway, but it lasts for 12 to 24 hours. Or they can be additive, where they are on the inhaled steroid and then they add that Singulair, montelukast medication. And again, if they are more severe, then the severe, again, is going to be an add-on strategy. So a person who has severe asthma may be on 3 or 4 different inhalers. But one of the things that has happened over the last 2 years is now many of the manufacturers of these medicines, these respiratory divisions of these manufacturing companies, have been able to combine these medications into a single inhaler, which has made it much more convenient for people instead of trying to navigate which inhaler and how much and how often. Now, some of these medications, there are several combination medications that have 2 medicines in them, and now there are 2 medications that have 3 chemicals in it. One medication is designed to treat asthma and COPD, and the other medication is designed to treat COPD. But we believe that it will get an indication for asthma in the near future. Now, after we have exhausted those medicines and a person is continuing to have symptoms, then that's when we can add on biologic therapy. And biologic therapy are typically monoclonal antibodies that are designed to help to block specific interleukins or specific mediators inside the body that will help prevent one from having progressive asthma or prevent them from having frequent exacerbations. So again, in overview, asthma can be treated and managed effectively, identifying all of the triggers, trying to eliminate those triggers as much as possible, and then adding medications onto their treatment regimen so we can get optimal control. The other thing that is going to be important to note is that we also recommend that a person have at their disposal very easily an asthma action plan, and we'll go more into detail on that because that reflects if someone has an acute asthma exacerbation, how quickly they can get their asthma under control, and that will be saved for another video in the near future. Thank you and see you soon.